If your doctor told you that high blood sugar after 60 is just something you have to manage with medication for the rest of your life, I want you to stop and watch this entire video. Because what researchers have uncovered in the last few years about how the aging body regulates blood sugar is genuinely changing the conversation in medical offices across the country. And the most powerful tools they've identified aren't new drugs. They're natural approaches that work with your body's own biology, and they work surprisingly fast. Here's what you need to understand right now. After age 60, your body's blood sugar control system changes in specific, predictable ways. Your muscle mass decreases, which reduces the main tissue responsible for pulling glucose out of your bloodstream. Your cellular sensitivity to insulin declines. Your liver becomes more aggressive about releasing stored glucose, even when it shouldn't. These are real, documented physiological shifts, and they explain why millions of seniors who ate perfectly well in their 40s suddenly struggle with blood sugar in their 60s and 70s. It is not a personal failure, it is biology. But here's the critical thing. These same mechanisms are highly responsive to targeted natural interventions, and that's exactly what this video is going to show you. I'm Dr. James, and this channel exists to bring you the latest evidence-based research on health topics that matter most to people over 60. Every week we translate what's being published in medical journals into clear, practical guidance you can actually use. If that sounds valuable to you, subscribe right now so you don't miss anything. Now let's get into these 5 methods, starting with the one that can produce results within 24 to 48 hours. Before we dive in, I want to mention something that surprises most people when they first hear it. The single fastest change you can make for blood sugar control doesn't involve a supplement at all. It doesn't require buying anything, changing your diet, or visiting a doctor. It involves walking. Specifically, walking for 10 to 15 minutes immediately after you finish eating. A landmark study published in the journal Sports Medicine examined the blood sugar response of older adults who walked after meals compared to a single 45-minute morning walk. The results were striking. The short post-meal walks reduced the spike in blood sugar after eating by 30% more effectively than the longer single walk. And a 2022 study in diabetes care found that even a 2-minute walk immediately after a meal measurably blunted the glucose response in adults over 60. Why? Because when you use your leg muscles within 30 minutes of eating, those muscles act like a sponge. They pull glucose directly out of your bloodstream and use it for energy, bypassing the need for a strong insulin response entirely. Here's the protocol that works. Eat your meal, set a timer for 15 to 20 minutes, then walk for 10 to 15 minutes at a comfortable pace. You don't need to power walk. You don't need to sweat. You just need to move your legs. Do this after your 2 largest meals of the day, typically lunch and dinner. Within 3 to 4 days, most people notice a meaningful difference in how they feel after eating. That heavy, foggy, tired sensation that often follows a high carbohydrate meal starts to fade. That is your blood sugar stabilizing in real time. Margaret, a 71-year-old retired school teacher, came to our attention through a shared patient case. Her fasting blood sugar was hovering around 138, and her doctor had already mentioned the possibility of adding a second medication. She was resistant to that idea and started implementing the post-meal walking protocol along with the second method I'm about to describe. Within 8 weeks, her fasting reading dropped to 112. Her doctor was so surprised he ran the labs a second time. The walking alone didn't accomplish that, but it was a significant piece of the puzzle and it cost her nothing. Now, the second fastest method involves a compound that has been the subject of intense scientific interest for the past decade, and there's a good chance your doctor has never mentioned it to you. It's called berberine. Berberine is a plant compound found in several herbs, including golden seal and barberry. It's not a vitamin, it's not a mineral. It's an alkaloid with a very specific mechanism of action, and that mechanism is one of the most studied in metabolic medicine right now. Berberine activates an enzyme called AMPK, which is often called the master metabolic switch. When AMPK is activated, it improves your cell's ability to accept glucose from the bloodstream, reduces the amount of glucose your liver releases between meals, and enhances the function of insulin receptors that have become sluggish with age. A meta-analysis published in the journal Oxidative Medicine and Cellular Longevity in 2021 reviewed 27 clinical trials on berberine and blood sugar. The combined data showed that berberine reduced fasting blood glucose by an average of 29% in people with elevated levels. An earlier but highly cited study published in Metabolism compared berberine directly to metformin, the most commonly prescribed diabetes medication in the world, in a head-to-head clinical trial. The outcomes were nearly identical. Berberine reduced A1C by 0.9%. Metformin reduced it by 0.8% in a 500-patient trial. Let that land for a moment. Now, does this mean you should stop taking metformin if you're prescribed it? Absolutely not. That decision requires your doctor's involvement. What this research tells us is that berberine is not a folk remedy or a fringe supplement. It is a clinically studied compound with documented, measurable effects on blood sugar that rival prescription intervention. The protocol for berberine is specific. You want to take 500 milligrams 3 times per day with each of your 3 main meals. This timing matters significantly. Taking berberine with food reduces the GI discomfort that some people experience and ensures the compound is present in your system during the periods when blood glucose is rising. Look for berberine HCl, that's the hydrochloride form, as it has the strongest absorption data. You also want a product that has been third-party tested and carries a USP verified or NSF certified label. Those certifications tell you the label is accurate and the product is free from contaminants. You can find quality berberine at Walgreens, CVS, or on Amazon. Search for berberine HCl 500 mg and look for those verification labels. Important cautions. If you are already on blood sugar medication, including metformin, glipizide, or insulin, you must speak with your doctor before adding berberine because the combination can lower blood sugar too much. Berberine also interacts with certain blood pressure medications and statins, so a conversation with your physician before starting is not optional, it is essential. Most people see meaningful changes in fasting blood glucose within 4 to 6 weeks of consistent use. I want to pause here and ask you something. Of the 5 methods I'm covering today, how many have you already tried? Drop a number in the comments right now. If you've tried 0, comment starting today. If you've tried 1 or 2, tell us which ones. Your experience might help someone else watching this video. The third method works through a completely different pathway than the first 2, and this one might surprise you. It involves a spice sitting in your kitchen cabinet right now. Ceylon cinnamon. Before I explain the mechanism, I have to make one critical distinction. There are 2 types of cinnamon sold in stores. Cassia cinnamon, which is the common grocery store variety found in most baking spice blends, and Ceylon cinnamon, sometimes called true cinnamon, which comes primarily from Sri Lanka. This distinction matters enormously for seniors because cassia cinnamon contains high levels of a compound called coumarin that can damage the liver with regular use. Ceylon cinnamon contains only trace amounts of coumarin and is safe for daily consumption. If the label on your cinnamon doesn't specify Ceylon, assume it's cassia. Now, how does Ceylon cinnamon affect blood sugar? It works through 2 mechanisms simultaneously. First, it slows the rate at which your stomach empties after eating, which flattens the curve of glucose entering your bloodstream and prevents sharp spikes. Second, it contains bioactive compounds called polyphenols that enhance insulin signaling at the cellular level, essentially making your cells more receptive to insulin's signal to absorb glucose. A randomized controlled trial published in the Journal of the American College of Nutrition found that participants who took Ceylon cinnamon extract saw a 29% reduction in fasting blood glucose after 40 days compared to placebo. A separate study from researchers at the USDA Human Nutrition Research Center found significant improvements in fasting blood sugar, triglycerides, and LDL cholesterol in people consuming cinnamon daily for 60 days. The protocol here is simple, but dosing precision matters. Take half a teaspoon to 1 teaspoon of Ceylon cinnamon daily, mixed into warm water, added to oatmeal, or blended into a morning smoothie. Alternatively, if you prefer capsule form, 500 milligrams per day of Ceylon cinnamon extract produces consistent results in the research. You can find Ceylon cinnamon capsules at most health food stores or online. When buying the loose spice, look for Ceylon or Sri Lanka origin on the package. This is one of the most practical things you can do, and most people notice its effects within 3 to 4 weeks of consistent daily use. But here's what surprised me the most in preparing this video. The fourth method works faster than any supplement. It works faster than cinnamon, potentially faster than berberine, and most seniors are severely deficient in it. I'm talking about magnesium. The connection between magnesium and blood sugar is one of the most underappreciated stories in metabolic health. Magnesium is required for over 300 enzymatic reactions in the human body. Among the most critical is insulin receptor function. Insulin cannot properly attach to your cells and signal glucose uptake without adequate magnesium present. When magnesium levels are low, insulin resistance increases directly as a result. Here's the alarming part. A large study published in Diabetes Care found that nearly 48% of people with type 2 diabetes have clinically low magnesium levels. And a 2021 analysis in the journal Nutrients confirmed that low dietary magnesium intake is independently associated with a 28% higher risk of developing type 2 diabetes. The older you get, the worse this problem becomes. Seniors absorb dietary magnesium less efficiently, excrete more of it through the kidneys, and frequently take medications like diuretics, proton pump inhibitors, and antibiotics that further deplete magnesium stores. A meta-analysis published in Biological Trace Element Research reviewed 18 clinical studies and found that magnesium supplementation reduced fasting blood glucose by an average of 4.5 milligrams per deciliter in people with below normal magnesium levels. That's a clinically meaningful reduction, and it occurred within 8 to 12 weeks of supplementation. The form of magnesium matters significantly. Magnesium oxide, which is the cheapest and most common form found in low-quality supplements, has very poor absorption rates of around 4 to 5%. You want either magnesium glycinate or magnesium malate. Both have absorption rates above 80% and are gentle on the digestive system. Magnesium citrate works as well but can cause loose stools in higher doses, which matters for seniors with sensitive digestion. The recommended dose for blood sugar support is 300 to 400 milligrams of magnesium glycinate per day, taken in the evening. Evening timing is preferred for 2 reasons. First, magnesium has a mild calming effect that can improve sleep quality, and sleep disruption is a powerful driver of blood sugar dysregulation. Second, the liver becomes most active at releasing glucose in the early morning hours, and having adequate magnesium in your system during that window helps moderate that process. If you are on any heart medications, including digoxin or medications for heart rhythm, please speak with your doctor before supplementing magnesium. High-dose magnesium can also interact with certain antibiotics, so flag it during any treatment. But for most seniors without kidney disease, magnesium glycinate at 300 to 400 milligrams per day is considered safe and is backed by solid evidence. Let's talk about the fifth method now, because I've saved this one deliberately. It's the one that requires the smallest behavioral change and has some of the most compelling research behind it. And it directly addresses one of the sneakiest contributors to high blood sugar that almost nobody talks about. I'm referring to the effect of apple cider vinegar on post-meal glucose. I know what some of you are thinking. Apple cider vinegar? That sounds like a kitchen remedy, not a science-backed intervention. I want to show you why that reaction, while understandable, doesn't align with what's actually in the literature. The active compound responsible for apple cider vinegar's blood sugar effects is acetic acid. Acetic acid works through a specific and now well-documented mechanism. It inhibits certain digestive enzymes, particularly those that break down complex carbohydrates. When those enzymes are slowed down, carbohydrates take longer to convert to glucose and enter your bloodstream at a slower, more manageable rate. The post-meal spike, which is the period that causes the most vascular damage in people with blood sugar problems, is significantly blunted. A study published in Diabetes Care, one of the most prestigious journals in the field, found that consuming 2 tablespoons of apple cider vinegar before a high-carbohydrate meal reduced post-meal blood glucose by 34% in people with insulin resistance. A follow-up study published in the Journal of Functional Foods showed that daily vinegar consumption reduced fasting blood glucose by up to 8% over 12 weeks in adults with prediabetes. The protocol is straightforward. Mix 1 to 2 tablespoons of raw, unfiltered apple cider vinegar. Look for "with the mother" on the label, as that indicates it contains the active compounds, into a full glass of water. Drink this 5 to 10 minutes before your largest meals, ideally lunch and dinner. Never drink apple cider vinegar undiluted. Undiluted vinegar can damage tooth enamel and irritate the esophagus. Always dilute it in at least 8 ounces of water. Some people prefer to drink through a straw to minimize contact with teeth. Frank, a 68-year-old retired contractor, started the post-meal walking protocol and apple cider vinegar routine after his fasting blood sugar reached 148. He was also following a lower carbohydrate diet. His A1C was 6.9, 1/10 of a point away from a formal diabetes diagnosis. After 10 weeks of consistency, his A1C came down to 6.3, and his doctor told him, unprompted, "Whatever you're doing, keep doing it." That combination of lifestyle changes and natural support made a measurable clinical difference. Do not take apple cider vinegar if you have a history of esophageal issues, gastric ulcers, or gastroparesis. It also interacts with diuretics and can lower potassium levels with prolonged use at high doses. Stick to the 1 to 2 tablespoon range, and you minimize those risks substantially. Now let me give you a clear, consolidated picture of exactly what to do starting today. This is how you combine all 5 methods effectively without overwhelming your system. In the morning, take 300 to 400 milligrams of magnesium glycinate. If you're also starting berberine, take your first 500 milligram dose with breakfast. Before lunch, drink your 1 tablespoon of apple cider vinegar in a full glass of water. Eat lunch, set your timer, and walk 10 to 15 minutes afterward. Before dinner, repeat the apple cider vinegar drink. Take your second berberine dose with dinner. Walk again after dinner for 10 to 15 minutes. At bedtime, take your third and final berberine dose if you're spacing them evenly, or take your magnesium glycinate now if you prefer the sleep benefit. Mix your half teaspoon of Ceylon cinnamon into your morning oatmeal, coffee, or a warm cup of water daily. Don't start all 5 on the same day. Give yourself 1 to 2 weeks with each addition before layering the next. This approach helps you identify what's working and reduces the chance of any GI adjustment period overwhelming you at once. Start with post-meal walking on day 1. It costs nothing and begins working immediately. Add apple cider vinegar in week 2. Add magnesium glycinate in week 3. Introduce berberine in week 4 with your doctor's knowledge, especially if you're on any blood sugar or cardiovascular medication. Add Ceylon cinnamon at any point along the way. How will you know if these changes are working? You need a reliable way to track your blood sugar. A basic glucometer from any pharmacy costs between $15 and $25. Test your fasting blood glucose first thing in the morning, before eating or drinking anything other than water, and test your blood sugar 1 to 2 hours after your largest meal. Keep a simple log. You do not need an app or a spreadsheet. A small notebook on your kitchen table works perfectly. What you're looking for is fasting blood glucose below 100 milligrams per deciliter as the long-term goal, and post-meal readings that stay below 142 hours after eating. One final thing I want to address directly. Some of you watching this are already on medication for blood sugar. Metformin, glipizide, Jardiance, Trulicity, or others. These methods are not replacements for your prescribed treatment. They are complements to it. In some cases, implementing these strategies consistently can lead to a conversation with your doctor about reducing medication dosages. But that decision must always be made with your doctor's oversight and input. Do not reduce or stop any blood sugar medication on your own. Blood sugar that drops too low is a medical emergency. The goal is to work with your doctor toward better outcomes, not to manage this alone. The most important takeaway from everything you've learned today is this. Your body's ability to regulate blood sugar after 60 is not fixed. It is not a permanent sentence. The research is clear that targeted, consistent, natural strategies can produce measurable, clinically meaningful improvements. And the 5 methods covered in this video represent some of the best studied, most practical options available to you right now. I'd love to hear from you in the comments. Leave me one of three responses. Comment all five if you're planning to implement everything we covered. Comment your current fasting blood sugar number if you're comfortable sharing, because it helps build a picture of what seniors are actually experiencing. Or comment sharing this if you know someone in your life who needs to hear this information today. Your comment might be exactly the nudge someone else needs to take their health seriously. If this video gave you something real and useful, subscribe to this channel right now. Because next week we're covering a topic that very few seniors are thinking about but absolutely should be. We're looking at the 3 commonly prescribed medications that quietly destroy kidney function over time, and what your doctor should be testing every 6 months to catch problems before they become serious. That is a video you genuinely do not want to miss. I'm Dr. James. Take care of yourself, and I will see you in the next one.